Folks, welcome to another episode of the IMGPH podcast. Today we have a special duo podcast with Stella Chong. Stella is currently a program associate at the Section for Health Equity, Department of Population Health at the NYU Grossman School of Medicine. And we have Shahmir Ali, who's a PhD candidate at the NYU School of Global Public Health with a specialization in social and behavioral sciences. Now, while we can go deeper into the work the two of them do, today we're going to focus on their research publication that has recently come out. And we want to talk about that, which is about an Asian American infodemic. Now, we will address some important themes around this research, but today we'll also love to get into more aspects about research and what's involved in a research process for the two of you to help other students or people that might be in the research process right now. With that said, Shahmir and Stella, welcome to the IMGPH podcast. We're glad to have you here.
Hi, thank you for having us.
Glad to be here.
Glad to have you. So let's just get started. So out of all the topics that you two are involved in, so many things out there, out of everything, what made you choose this target? Why this area? What influenced that research area for you?
Yeah, so we actually decided to focus on misinformation and the use of social media among Asian Americans because at least in my center, which is called the Center for the Study of Asian American Health, we work a lot with the community organizations and long-term community partners who actually have, community events where they directly interact with community members. And a lot of these community members, during the webinars that we host about like COVID-19 vaccines and whatnot, we've been hearing a lot of concern about all the things that they've been hearing through social media about the vaccine, about like treatment for COVID. And this was particularly true during the beginning of the COVID pandemic, where a lot of the folks in the community were getting their information through social media platforms. So that would be like WeChat for the Chinese American community. And it's really important to note that we decided to focus on social media and misinformation on social media platforms because we know that like a lot of these community members, they may be limited English proficient, and so they might turn to social media platforms that have readily available health information in their own language. Yeah, so Shahmir.
Yeah, no, I think echoing Stella's comments, I feel like, in the last 5 years in particular, there's this big realization that Asian Americans are a very, very understudied group, especially with the stats showing that they are now the fastest growing racial and ethnic minority group in the United States. And I think that that sort of thankfully new and consolidated research interest and effort into this subpopulation of Americans come to the realization that it is one of the most complex groups of Americans as well. And I think complexity is what truly defines a lot of the Asian American experience. And that complexity is ever more present in the context of misinformation. I think that, as Stella was saying, that we are seeing misinformation during COVID. It's been in the headlines, it's been in the news, we have had that understanding, but what we have thus far been looking into in terms of prevention efforts, as well as research efforts aimed at deconstructing it, have largely excluded the unique experiences of Asian Americans. And I think, the aim with this paper was to essentially call attention to that. And I think a part of calling attention to that is sort of answering the question, why? Why should we be paying attention to the unique needs of Asian Americans in the context of misinformation? And I think that's the essence of the paper, as we show that going back to the complexity sort of dimension, that it is very different. And I think the complexity on one hand stems from the fact that Asian Americans face this confluence of Asian and Western influences when it comes to their health experiences, their social experiences, their acculturation, but then especially in the context of misinformation, when the very apps, the very platforms, the very experience is intersectional. And I think that's where you have the ideas of sort of the platforms such as WeChat, WhatsApp, and these platforms that for the average American, these platforms that are even being used in America are evolving constantly. But I think the popularity of these certain platforms is distinct in the Asian American populations. And I think what we called attention to is what we really have not been considering is that these Asian American specific platforms are uniquely susceptible in many ways to the pervasiveness, uncontrolled pervasiveness of misinformation. And I think the one thing that we called attention to was the invisibility that often occurs in WhatsApp messaging sharing. You have this large group of your family members, half are in, let's say, India or Philippines, and half are here, and you're getting misinformation both from different sources, but then you don't really know where it's coming from because it's forwarded into your WhatsApp group chat with like 20, 30 people. And then you have that uncle of yours who then forwards it onto another 20, 30 group chats. And so then there you go, you reach 100,000 people in the blink of a second. And one of the questions we get, and Stella can probably talk more about this too, is what is this misinformation? Like what is it? We're getting some early reports about what it is, but ultimately, because it's so difficult to see and examine in a systematic sense, in a way in which you could like download a bunch of Twitter data or Facebook data, you can't really do that with WhatsApp or WeChat. So I think essentially that's sort of the premise of this research study, was to call attention to the complexity of the issue and the complexity of the research that's required.
Right. Yeah, our goal is really to bring awareness that there is social media usage among the Asian American community, and in that there's a massive amount of misinformation there, and we really want to point attention that we know that misinformation is a public health issue, and we know that a lot of public health officials know that it's an issue and are working with a lot of social media platforms to counter misinformation. But what is lacking is that there is a lack of targeted intervention for these social media platforms that are more tailored for the Asian American community. And so in a section of our research, we call for that. And we think that, there's so much more that can be done, especially in the community based efforts. We can, educate and bring awareness about misinformation to our community members, teach them how to identify correct scientific information, help them evaluate that on their own so that they just don't fall mistakenly into a family group chat and just trust that one misinformation they hear. And because it's from their family and friends, they might be more likely to believe that information, even though it might not be true. So we call upon that. And just there just needs to be more focus on misinformation because it's so heavily tied to global politics. And with COVID-19 misinformation, sometimes it's inadvertently turned political. So, we just want to highlight that as well.
Well, good enough reason to do a research. That was that's very relatable, and I'm sure it's there's no doubt that's very important to address. This is a public health issue. What I'm curious to hear from the two of you is, what are the most shocking things you learned that people are believing right now in your research so far? Or maybe there might have been a shocking thing that you noticed that made you want to start this research. Anything that stands out to the two of you?
Yeah, okay. So maybe this is a misinformation that I hopefully the community members don't believe in anymore, but this is what I heard during the start of the pandemic among the Chinese American community that was widely spread on WeChat, which was to drink hot water at 15-minute intervals to prevent the COVID-19 virus from being from contracting the virus. And I thought that was really interesting. And this was I first heard about it way back before we even started our study. Even before the pandemic, it was declared a pandemic. That was among the Chinese American community. I heard it from my friends when we were eating outside. So I think it just goes to show that the underlying presence of misinformation goes prior COVID-19, and now it's going to be persistent beyond the COVID-19 pandemic, and we need to learn how to deal with it. We need to learn how to counter it, and that goes to say we have so much more that needs to be done.
Yeah. And I think building off of that, for me, I think what stood out was actually two things. Whether or not they were surprising, I suppose, is a separate question. In many ways, I suppose it wasn't surprising that. So the first thing that stood out to me was misinformation tied to existing conflicts across religious and cultural lines within the Asian American community. And I think one part is like, that I, contributed particularly in this context of this paper was the South Asian experience. And I think that, for example, there's pork in the vaccines, or there's animal-based products in the vaccines, and sort of that unique level of nuance and implications in the context of the Asian American experience that such types of misinformation have, I think is particularly noteworthy. Whether or not the vaccines are halal, or like these are the nuances that were, I think, very unique, right, to the Asian American experience, and what the misinformation, how it played out in this specific community. And so I think it becomes really difficult and dangerous when you begin to bring up religious and cultural divides that are existing in Asia, full stop, not just Asian American communities, but that do carry over into the same ways into Asian American experiences. So I think that's where working then with imams, with various community leaders, right, to be the agents of change that work to address misinformation and disinformation, is what I think is crucial. So I think that's one thing that stood out. The other thing that stood out to me was misinformation that connects to the immigrant experience. And this is, I think, where it also intersects with various other subgroups of Americans, the Hispanic American community and other immigrant communities, full stop. America is a country of immigrants. To this day, a huge population of first-generation immigrants who are of different migration statuses. And with the onset of various government-sponsored vaccine efforts, government mandates, and various government-related activities, comes that implication in terms of what does this mean for me to access this resource in the context of my immigration status? And there is a large community of undocumented Asian American immigrants. What misinformation is there that might be inhibiting this community of Americans to be accessing COVID-related services out of fear that their migration status might be disclosed? There have been efforts to address that misinformation now, and that, you don't have to declare whether or not you are documented or not. You don't have to provide these, these certain documentations. But ultimately, whether or not those are reaching the communities is a whole different question. And whether or not misinformation is pushing people away from vaccines, or being exploited by people who don't want people to get vaccinated in the first place, and using these concerns related to religion or culture or immigration, which are the facets, the tenets of the Asian American experience, I would say, is what stood out for me in terms of the content of misinformation.
Right. Yeah, I would definitely agree about the Asian American experience. And in our paper, we break it down by Asian American subgroups. And there was something that stood out to me for the Vietnamese American community, and how a lot of their misinformation is tied to the Asian American experience and the historical experience. So we actually reached out to Pivot, which is the progressive, give me a second, I always forget this, but Pivot, it's the progressive Vietnamese American organization. And they actually have a project called the Viet Fact Check, where they counter misinformation that's circulating among the Vietnamese American community. And during my outreach to them, and I asked them all about misinformation as part of the research, I was surprised to find out that a lot of misinformation was tied to the political views of the Vietnamese Americans, and it tied to red baiting, which is basically ties of like how the conservative, like communism back in the old days, how that has projected onto the ways like Vietnamese American, especially the older generation, consumes their media, and how they perceive like news, and now that has translated to a lot about like COVID-19 vaccines and the misinformation. So a lot of that is contributed due to the politics, like underlying politics. So that was something that stood out to me, and I think it's something that is worthy of further research in terms of like politics and then public health, all that intersectionality between different disciplines is needed for like misinformation. And that was just very surprising to me because I was just like, it's just social media, it's misinformation. Why are there so many different like outlets that need to be plugged in to counter this? So yeah.
Oh, wow. Oh man. All right. Well, there's a lot there's a lot that's going on, and your research has been conducted, and now there's something out there. What could you see? I know Shahmir mentioned something about change, and this is the catalyst for change. But what is the how do you hope that this would affect people's awareness? What is the change that you hope for with this research?
Yeah, so in terms of sort of change, next steps, and actions, I think there are sort of two key facets. And I think this is sort of the every like research in general, like the conclusion section is always, it's split up into those two things, right? It's the policy and then the research implications, because ultimately research is iterative. And given the nature of the study as a sort of a commentary and a call to action as opposed to an empirical analysis. That research element is sort of, I think, one of the key things we really need. In order to facilitate sound, evidence driven policy action, we need sound evidence to do that, right? So I think that's one thing we called. And a part of that, as Stella was mentioning, right, was reaching out to organizations, entities, projects that, and highlighting them as part of the study that are doing this research. Another study that we highlighted that's been really interesting and novel is the CARM study that's been largely among South Asians. And the CARM study, I believe, I will double check, I think it's based at UCSF. Um,
UCSF and Cal State East Bay, I
yes,
believe.
that's right. So they're leading this study, the CARM study, and this has involved essentially analyzing WhatsApp messages. I mean, right? Like, I mean, the thing I love about public health methodologies is they're so innovative because health is so complex. So you have to take complex approaches. So they're literally analyzing. They're asking people to send anonymized, like, basically send WhatsApp messages to them, and they're going to analyze that. Because one question we've been getting as well is, what is this misinformation? We're seeing a little bit of it, but I think that goes back to the issue that we don't fully know because it's largely invisible because of the nature in which it is being transmitted. So I think that's the big area, is research should now there should be consolidated research efforts like CARM to analyze this misinformation in order to understand what is being shared, where it's coming from, who it's going to, who is most disproportionately affected within the Asian American community, right? Because as you know, this is not a monolith as well. There's first gen, second gen immigrants. There's lots and lots of ethnic subgroups of Asian Americans across the South Asian, East Asian, and Southeast Asian subgroups, and beyond for that matter, right? And all of them of different linguistic backgrounds, different cultural backgrounds, different religious backgrounds. Are there certain facets that we should be paying more attention to and who are disproportionately affected by misinformation? Is, I think, that it's still not fully understood. So I think identifying that gap has been one of the key goals of the research. But what we do know is that Asian Americans are experiencing misinformation. This is happening. So aside from research, we have the policy goals that we've kind of advocated for, which involves efforts that are currently underway for health communication with respect to COVID, to ensure that those efforts are in language, to ensure that those efforts are being transmitted not through Facebook posts on like verified Twitter accounts or something like that, right? Like the Department of Health can do that, but are they reaching the Asian Americans? That's the question of the hour. For the most part, probably not, right? So do the Department of Health have a WeChat account that they're able to reach the Chinese American communities? Do they have a WhatsApp system, right? And so there's a lot that actually can be learned from Asia itself, in efforts in places like China, India, Philippines, and large Asian countries that are also grappling with their own issues of misinformation in their populaces. What can we learn from there, perhaps, as well, in terms of what efforts we can adapt in the United States to reach Asian Americans from a policy level and from a communication level? So I think those are sort of the hopefully the areas of change that we're seeing, that we hope to see moving forward.
Right. Yeah, Shahmir brings up a really great point about how we can also collaborate and learn from other countries, especially in Asia, because a lot of the misinformation, it just because it's social media and we are in such a digital state that all the misinformation basically crosses country border lines. What is going on in Asia is happening here too, and it's really important to really understand what's going on in Asia to apply that here as well, and then to address the misinformation. And in addition to what Shahmir was saying, we also highlight the need to utilize more of the community-based intervention. So it would be having community health workers really bring awareness to the community members and teach them, hey, this misinformation is going around in your community, and here are some actual scientific resources that you can look into, and really try to teach the community about the fact that misinformation happens. And yeah, so that's one way that we really think that could be of use to, especially in the Asian American community, where because of the language barrier, they might be more willing to, interact with community organizations and community health workers to get their information and, just be able to, easily have access to information without feeling any fear of like immigration concerns or like fees and whatnot. So yeah.
There's a lot of people who have made it to this point of the podcast that are thinking about their own research, that are inspired by the things that the two of you are talking about, finding your area of interest and doing research. So this might be a very general question, but how should someone go to tackle research in their field? I'm sure there's a lot of people out there, prospective students, current students, that have no idea where research even begins. What could the two of you share when it comes to that as seasoned veterans at this point?
Well, there's still so much to learn. I am actually not a student, but I'm very fortunate to work at a center that does research, and a very community-based research with the Asian American community. I think to get your foot into research, you don't have to be a researcher. You don't have to be a student. I think you have to, most importantly, have the heart of using that research, using the information you gather, whether it be quantitative, qualitative stories from the community. You have to turn that research, that information you collect, in a way that can be transformed into like a policy and actionable item that can help and actually address the needs of the community members. And in terms of getting started in research, I think it's really important to be able to find mentors in the field, and peers who are willing to, collaborate with you on these issues. And yeah, for me, it was really reaching out to people with the same interests, like Shahmir with the Asian American community, and recognizing that we both are really interested in helping the Asian American community, and recognizing that, this is an issue in the community that needs to be addressed. And by addressing it, that we can really help the community. So yes, that's what I have for folks who want to be part of research. And yeah, I think the first step to getting started in research is finding out what you care most about, finding who's doing the work out there, and not being afraid to reach out to the researchers, whether they be like the top of the field of the topic. Shoot them an email and just be like, I'm interested in your research. I want to learn more. Is there a way for me to participate? Because I feel like I know like everyone has their unique experiences to bring to any research team.
Yeah. I think Stella summed it up really, really well, and I'll build on that. But I think I love this question. I think it really ties into the complexity that is to do research, and what is research at the essence. So I'll start there. I think people, in my experience of now doing research in public health now for some time, don't realize what the extent to which the scope of what research is. In short, like research can be more than what you think. Oftentimes there's that assumption. I think hardcore epi people are sitting there looking at their large NHANES data set and like, this is research, the end, good night. No. So I think ultimately one has to realize, and I think we're seeing this in the field of public health, it is becoming so interdisciplinary, so complex in terms of methods, right? And why? For the reason, as we were describing, is because health is so complex. And to analyze complex issues, you need to take complex methods. So I think knowing that very fact, that what you find is interesting, if it's not reflected or it's difficult to capture quantitatively, it's very likely that it needs to, or is already it's already being captured qualitatively through efforts. I know that's been a big area of my work at GPH, is through qualitative methods. I worked with a team, for example, we did a study that looked at eating behaviors of South Asians. And that's been a big area of research and interest for me. And I felt that, the current ways of just, how do people currently research? You either give them a survey or you interview them, right? That's the pillars of public health. And it was like this too vanilla. And especially in the context of food, which is as spicy as it gets. Like, how do you capture that, right? So basically we sat down, it was with Dr. Alexis Marjanoff, with Ralph, Dr. Ralph De Clemente, and Dr. Niyati Parikh. We were like, okay, let's think a little bit harder here. So what's a better way we can capture food and the complexities that is to eat? And we basically we developed a method, which was a mind mapping method that involved 2-3 other qualitative methods, where we, instead of asking simply like, how, what are the factors that are involved in your eating behaviors, we sat down and we drew a map. You're like, this is the reason that I typically eat. And it was like this colorful mind map we drew. And what did that allow us to do? That allowed us to capture some facets of eating behaviors and connections between drivers of eating behaviors that through interviews and other methods, we weren't able to capture. I think another thing I'll mention is I'm working with teams, this really interesting study at Stanford, I'll give them a shout out, that's doing an intervention, a public health intervention that is through theater. Like they're doing like a theatrical performance, and that they're going to look at that pre-post changes in they're looking at different outcomes related to family communication and acculturative distress, essentially, and seeing if a theater-based intervention could improve public health. So basically, building on Stella's point, your interests in public health is probably, I will argue, the most interdisciplinary field there is on earth. And I mean, we're seeing that in COVID. Nothing is not related to COVID, right? Anything that you're doing in life is related to COVID, which shows what public health is. Anything you do in life could have public health implications. Theater, archaeology. I did a project with archaeology in undergrad that was looking at using, what's the word? Ethnic heritage and heritage-based motivation to improve, to encourage careers in water management and sanitation in Pakistan. So we basically did a video series that involved like showing people the Indus Valley civilization and like all the efforts that they did and the amazing work that was done there in terms of the first potable water sources and as a means of public health.
Right.
The point being is that public health itself is bigger than you think, and also methods of public health can be bigger than you think. So keeping that in mind as a means to ensure you're still motivated to work in this field, even if what you might be interested in is not within the confines of what you traditionally think. I'm looking at coffee and hypertension, right? It doesn't have to be that. It could be more than that.
Right. And to add on, I think as some, if you are just getting started in public health, it's very easy to get lost in thinking that public health is just numbers, it's epi, it's statistics. I think public health is it's a lot more than that, especially if your ultimate goal is to advance health equity and eliminate health disparities. Sometimes you have to go beyond the data. You have to hear the narratives, the stories, the lived experiences with the community members to hear what their needs are and understand the structural factors that really shape their health. And you have to turn to other disciplines like anthropology, sociology. It's just a bunch of different interdisciplinary disciplines that you have to turn to. It's not just one method, it's multiple methods. And I think that's why I love public health, because there's never a boring moment. You always have a new question, and then once you find new question, new problem, you're finding different multiple ways to try to figure out what the situation is, find the best intervention, best solution. So yeah, I think Shahmir hit all the points.
Yeah. I mean, I felt both of your excitement. So if I could summarize it for the listeners, I would love to share mentorship is important. Reach out to people. Everyone is interconnected. I was curious about data, and Shahmir really helped open it up, because a lot of people come in saying, I'm really bad at math. I don't understand statistics. How do I find that direction? And there's so much interconnectedness that is there. And your research currently, who thought that misinformation and WhatsApp and WeChat is going to be something that's addressed in a public health study? And that's evident to what's out there, and what how everything is interconnected in today's world, especially with public health as a for a future student or even a current student. So I'd like to ask one thing then, for someone that is rather confused in their own path. So we've understood how you can find your own direction, but how does someone find that direction for themselves over here? How do you locate your interest, right? Because oftentimes people come to university with an indecisive mindset. There's so many things that you want to do that you can't figure it out. What are some guides that you have worked that have worked for you in your own life, or that you could help others with?
Yeah, this is another really great point, right? You sometimes that can be a blessing and a curse to be interested in anything and everything, and I think that's something that is the story of my life, basically. And so I can tell you a little bit about how I grappled with this. Essentially, is that sort of so basically, at undergrad, I started doing. I joined a lab. I think that's the first thing. Is just join a lab, and it might not be a lab. Like you might have some underlying interest on a certain, so I see interest kind of dissected across populations. Like I'm interested in this community, this community. I mean, that's kind of our situation where we're Asian Americans is our main population of interest, and it's currently my sort of main focus. It might be on a certain health issue, whether it be chronic disease, cancer, mental health, depression, something like that, or certain methods. I see a lot of people in doing because I've been a TA for thesis, so I know like where people are coming from and like what their interests are. And so some people are interested in certain methods. Like there's this, like particularly the biostats people, like they have this cool, complex data science thing that they're doing. And I mean, like, you can tell I'm not very like I'm more qual leaning, if that wasn't obvious enough. But they have a method of interest, and the topic or population is less of concern. So these are the key facets that might come into consideration. But first thing is to find a lab just to do work. It might be, you might be really data science heavy, but you might find a qual lab that is just an opportunity, because basically a professor had a class at undergrad and he said, oh, we need some help at the end of the lecture. And I was like, okay, I need to, I was intimidated by all the pre-meds at the time. Like I need to join some labs too, because they're all doing, so I joined a lab at the time. And it was the best decision, because initially I remember I did nothing for like a good 5-6 months. And you might find that with starting research is your work that you are looped into or can do yourself, because it's a capacity building process. Doing research is hard. It is not easy work, irrespective of the methods. Rigorous, scientific, meaningful research is difficult. It cannot, and it's difficult for a right reason, because you want to make findings that are applicable, that are meaningful, that are understandable. So I was doing menial work for a while, but then essentially I was given opportunities to dabble at this, dabble at that. And as Stella was saying, mentorship is important. But I think one thing I'll add to that as well is you will find mentorship from people you might not think. The senior, whether it be a senior MPH student in this case, for example, who is working in that lab, might be your main mentor. It might be the professor, it might be the PhD student, it might be the postdoc. In reality, it's most likely going to be a combination of all of those people. And the mentorship they might provide you is different types. So you'll want to absorb that. Like some, you might be inspired by a certain topical area based on somebody's passion. And that passion just topically might, oh, I want to do this work after that. That's basically what happened with me in undergrad. It's like I love food, and I love the passion that was being transmitted, and so I did that. Passion will only take you so far, though. Sometimes, right? Is if you aren't able to learn the skills in that process, it'll be difficult, and that's the reality. Which is where I think the substantive help from people like the PhD students, the other senior PhD students, asking them, even if it's on a secondary capacity, to assist in their papers. I will help write your background section or your discussion section. Like, give me a chance. I want to at least see you do that process, even if I'm not going to do it myself, so that next time I can do it myself. So I think observing is the first important part that's helped me. And then the best place I think I've it's like a very slow process. Like you begin with regressions. Like I remember I did regression after regression. I've been living on regressions for 2 years, and now I'm actually doing something a little bit higher. So I'm doing structural equation modeling for the first time. I'm doing a psychometric analysis. So you'll want to find research opportunities that are able to level up in an iterative way that complements each other, and it kind of pushes you. So it is a very independent process, but it's one where you have to kind of find that mentorship, pull that mentorship in, and be willing to do something that is beyond your confines of interest, because you might not know where you're. Like, I mean, I do eating behaviors research, and we're talking about a misinformation paper, right? That's okay. And you also should feel that it's okay to be interested in multiple things more, because I mean, that's the public health professional, full stop, is someone who is able to drop what they're doing and focus on a health issue. That's what happened with COVID. Everybody stopped, did COVID, basically. It happened with AIDS. Everyone stopped what they were doing, focused on AIDS. So it's a field that's inherently evolving and moving. So it's unlikely you'll be stuck on that one issue in this profession. You are going to be evolving. So you can feel that energy as you go and you look for research opportunities as well.
Mm-hmm. I think, yeah, those are great points. I also want to add that your path or your journey to public health is not linear, at least not for me. Like, I was definitely not a public health person in undergrad. I did not concentrate in public health. I was pre-med, did like human bio and anthropology. But I think what pointed me to public health was realizing that my extracurriculars and all my summer internships were very community focused. They were immigrant health focused, and it was a lot of interaction with community and seeing how their health was being shaped by what was going on in their lives. And even after graduating from college, I was still lost for a while. I was like, I like health, I like helping people, but I've been stuck on this pre-med dream for so long. Let's hold on to it for a little bit more. But it only took experience at more internships and being at my center from an intern, and then reaching out to community to realize that, hey, I actually do like the community aspect. I like to prevent health, to help people achieve good health. It's not it's like, how do I say it? It's just like
primary health. Yeah, primary prevention. Exactly.
Exactly. It's all about prevention and the community aspect and being able to help not just one individual, but multiple individuals on like a macro level, but also the micro level of being able to interact with the community and listen to their needs. So that's what like pointed me to public health. And in terms of topic, like, I do work in Asian American health, but I can say that I don't have a specific topic that I'm honing down on, because like most people, I'm interested in everything, right? But I think that's okay, because that opens you up to more opportunities that you might not even know of, and yeah, it just keeps changing. And I think it's totally okay to not know what you're focused on. And for those who are not in school yet, like I'm not in school, I'm about to go back to school. I think that's why people go back to school, go to MPH schools to get their degree. It's to get more of the experience and see what exactly they're interested in. You won't know until you try, essentially. And for me, I still don't know, but I know for sure that based on my own personal background as like a local native New Yorker and coming from an Asian American immigrant family, I want to work with low-income immigrant population who unfortunately have a lot of barriers to their health access. And I really want to help this community achieve health equity and prevent any diseases that might come along their way, especially if we know that these things can be prevented. So that is like the basis of what my interest is. And I'm going to be using that in the near future to, like, I guess, target something more specific within that community. But yeah, again, it's okay to not know what your interest is, but with experience you will know. So.
I thank you both for sharing all those personal stories, insights, and even advice for someone that this is a very helpful answer. to a lot of people, and even to me who doesn't do research. It's very insightful to hear these things. I'd like to end on this last question. You two clearly have a passion what you do, and this might be a difficult question for Shahmir to answer because there's so many interests. But what's that one thing that keeps you going every day to do what you're doing?
Honestly, I don't know. Like, I ask myself a lot about why am I in public health? Because we know that, you know, the field isn't as high paying as compared to other fields. Like, why do I think about like going back to school for next degree and all of that? But I think what keeps me going in this field is knowing that through this discipline and through the research and all that hard work, I am able to connect with the community and be able to make a change. I think it's really important that, whatever discipline, whatever career, you can help and utilize that to create positive change. And in our case, that would be helping folks improve their health and well-being. I think that's my ultimate goal. And going back to my own personal immigrant experience with my family, I saw how my parents struggled with their access to health. And so, when those memories come up of how I had to help my parents, get their health insurance or get their medication, those things, they are constant reminders of why I need to also help folks who may be experiencing similar situations right now in their access to healthcare, and also understanding that there are more barriers, and if I can address that and help them just improve their health just a little bit, I think that motivates me to keep going. But certainly it is hard, especially public health as a profession. As I mentioned, it's not the highest paying, but you get a lot of satisfaction from seeing what you can do for the people around you. It's really hard to say.
Yeah, and I think building off of that, so for me, I'm trying not to be cliche, but it's really that I like it, like it's enjoyable, like, you know what I mean, like, and I'll tell you what I mean. But I'll tell you. There's a couple of reasons why I genuinely find that the people in public health are just the most interesting, quirkiest people ever. And I think that is what pulls me to it. It's like I like working and talking and engaging and communicating with people. If you like people, then you should do public health. I mean, literally said the name, right? Public. So that's what it stood out for me. And I think that's what it makes it a distinction from the field of like medicine and other things, where you work at a much more individual basis, and it's a much more grueling process. Like, I know that's where, for me, I actually never even considered medicine for that reason. I was like, I know the process, I know the cost benefit, and I want to, like, and for many people, that is their calling, like going through that ordeal and being able to have one-on-one interaction with people. But the thing is, you can do that in public health too. Like, you know what I mean? Like, I've been a data collector for both quantitative and qualitative studies, where I interview with people. You do that engagement dimension. You do that without having to do the steps and all the GMAT and XMAT or whatever, right? So you have to. So it's that, for me, I'm able to do that people engagement dimension. That is a pull factor for some people for medicine. But at the same time, like, I'm working virtual, and I'm like, it's a much more stress-free thing. Like, I actually like thriving. Like, you can relax and you can have a nice, comfortable life, I think. And that, for me, that overarching, the pace of life, the types of activity you do in public health is what I like about it. The other thing is, I don't feel confined, right? Like, going back to that, I'm just like, I am just too much sometimes, even for myself. So I just like, I want to do the next thing, right? And I can do that in public health. I can literally, Stella and I have worked on a study that was essentially going into economics and marketing, a little bit of the CoClo study, right? Where we were essentially looking at closures of restaurants, right? Public health relevance. But we borrowed a lot, and we had to cite a lot of literature from marketing and economics and stuff like that. And I mean, there's a whole social marketing theory that I bet a lot of the MTH students are studying in their classes. I teach an undergrad class, and I have a whole lecture on that too. literally we have to borrow all these things from other
Mm.
professions. So
Mhm.
point being is, I don't feel I have to settle ever. And I think I don't feel like if I'm bored, I can do another project. And I think as a PhD student and going into academia, which I should say, a lot of MPH students may consider that, a lot might not. I'm speaking to those who are considering academia. That's what it kind of is. You're
Mhm.
just doing stuff, and you are holding the reins many times. I have to create projects sometimes and create data sets, and I thrive over that. I am that type of person. So there's that, but there's also a huge, like the big one of now the biggest employers for MPHs. I mean, MPHs definitely, but even for public health PhDs is industry. Like going and working at Google, I've heard has like social and behavioral sciences department too. So it's a very applicable field. It's a very marketable field. You can fit in everywhere and anywhere.
Mm.
Yeah, I mean, obviously we're sitting at a bunch of public health people. We're very biased, but I mean, that's what pulled me to this field in comparison to many of the other fields. Yeah.
That's true. That's true. Definitely in terms of academia, I think like if you're in academia with a PhD, you have so much flexibility in like you have something that pops up in your brain, like a light bulb comes up, you can just study that question and find multiple ways to study, and so you're never bored. And then in terms of those folks who are more into the practice of public health, I don't think you ever really you don't really have to worry about there's no job mark opportunity out there because public health is so flexible. It's you can find a job with your MPH degree without even really recognizing that your degree is so helpful for that. So I think, yeah, in both aspects, practice or academia, you're never bored. There's always something out there in public health. And I think it goes back to the root of public health, right? Because it goes to show that your health isn't just one way. It's not linear. It's not just, oh, it's because your body, something's not functioning and you're sick. There is just so many different factors in our lives that are impacting our health. And in academia, we have multiple questions to target that. And then in the marketing job aspect, you can, like Shahmir said, industry that we can target health in a different way, or whether it be like, I don't know, healthcare consulting. That's like public health consulting. That's another aspect. Yeah, there's just many different ways that public health can be like applicable. So yeah, I think as someone who's kind of undecided between academia and the corporate industry world, I'm like, I can go both ways, right? So that's kind of like the certainty that I have with public health, and I like that.
Wow. Folks, that was a podcast full of golden nuggets all throughout. And I thank you. I thank you too for being so open, kind with your information. This is going to be a gift for a lot of people that will listen to this in the future. So thank you for your time, Stella and Shahmir, and good luck for everything that's coming your way.
Thank
Thank
you so
you.
much.